So we've talked in the past about urinary incontinence and leakage of urine, but another very common type of incontinence is called fecal incontinence, and that's actually the loss of stool or the loss of a bowel movement in an uncontrolled way. And when I say common, what I mean is that this affects up to 8% of the population. And in fact, 8% might be an underestimate because, like many types of incontinence, fecal incontinence is something that many people feel very embarrassed to talk about or very uncomfortable to talk about. And sometimes even when they're asked about it, they don't necessarily answer truthfully. And so we know that probably at least 8% of the population experiences this, but it may be quite a bit higher. Fecal incontinence is also one of the more distressing types of incontinence, and it really can inhibit the way that people lead their lives. In fact, if patients experience fecal incontinence, they may not want to leave the house at all. They're afraid that they're going to get into a situation where they may have a loss of bowel movement, a loss of stool, and just be in a situation that's really very embarrassing. And sometimes just the fear of being in that type of a situation, of having that kind of loss of control, can have people really shut down and not do the kinds of things that makes life so enjoyable, right? So these are people who don't go to restaurants and don't go to sporting events and don't go to religious services. And it can really be very limiting in people's lives. There are actually a lot of different causes of fecal incontinence. Trauma, previous surgery, you can have neurologic problems, even problems with previous pelvic radiation. All of these things can lead to fecal incontinence. But it might be that one of the most common causes of fecal incontinence is none of these things. Just fecal incontinence that sort of develops on its own for reasons that we don't always know. And interestingly, this type of fecal incontinence, we may actually be able to do the most to help patients with. Like many types of incontinence and many types of pelvic health treatments, we oftentimes start with relatively conservative therapies that people can do on their own. In the case of fecal incontinence, we might try to adjust the consistency of a bowel movement. If patients have issues with constipation, we may try to soften the bowel movement and make constipation not such a problem. If patients have problems with diarrhea or bowel movements that are too frequent or too loose, we might actually try to give them medications or changes in diets that can firm up the bowel movement, and both of those things can help. Some things that work in other areas of pelvic health, like urinary incontinence, such as pelvic floor exercises, can be effective for fecal incontinence as well. However, in patients that don't see response to more conservative measures, there are some surgical therapies that can treat incontinence. One of the most common treatments, one of the most common surgical treatments for fecal incontinence is something called neuromodulation. If you've studied or been exposed to any of the treatments for urinary incontinence, neuromodulation might sound familiar. And in fact, it is the same type of neuromodulation that we use to treat urinary incontinence. But there's a lot of overlap between the types of nerves that govern urination and the types of nerves that govern bowel control. And so it really shouldn't be surprising that neuromodulation is a very effective treatment for certain types of fecal incontinence.